The Hellenic Society of Chemotherapy has provided major contributions in the field of clinical research, which changed our way of thinking of infectious diseases. Before the pandemic, precision therapy for infections was viewed as an idealistic and somewhat unattainable goal. The program SAVE was designed early during the pandemic to recognize the patient admitted with COVID-19 pneumonia at risk to progress into respiratory failure and need of mechanical ventilation. The biomarker SUPAR was the tool to select patients at risk and guide early treatment with anakinra. This precision strategy was registered by the European Medicines Agency and by the US FDA. The ACCESS trial showed how a specific phenotype with community-acquired pneumonia guides physicians to add oral clarithromycin to the standard of care. Adjunctive clarithromycin treatment leads to early attenuation of symptoms and inflammation, and through this action, to decrease the risk for mechanical ventilation and for secondary sepsis, reaching earlier hospital discharge. In the Immunocept trial, ferritin and HLA-DR are used to classify sepsis patients into strata of immune activation and deliver precision treatment.
The Hellenic Society of Chemotherapy is encouraging research and innovation with a goal to combat antimicrobial resistance. The Executive Board Committee is achieving so through 7 study groups. The Hellenic Sepsis Study Group is a founding member of the Global Sepsis Alliance and is led by Professor Haralabos Gogos. The Hellenic Study Group for Personalized Treatment of Infections aims to introduce biomarkers to guide antibiotics for the most appropriate cases. The Hellenic Study Group for Combating Antimicrobial Resistance in Critical Ill Patients aims to educate on strategies that promote appropriate antibiotic treatment for the ICU and immunocompromised patients. The Hellenic Study Group on Community Engagement for Combating Antimicrobial Resistance aims to inform general community, including patients and relatives, on the good practices of antibiotic prescription and prevention of infections. The Hellenic Study Group for Combating Antimicrobial Resistance in Patients with Surgical Infections aims to teach the appropriate antibiotic treatment for surgical patients. It collaborates with the Hellenic Society of Surgical Infections. The Hellenic Study Group on Endocarditis has a broad collection of cases with endocarditis over the last 20 years and guides research in the field. The Hellenic Study Group for Career Counseling of Young Scientists in Antimicrobial Therapy and Resistance envisions to build a generation of healthcare professionals with broad concept in the field.
The Hellenic Society of Chemotherapy has a long track record of organization of international medical events. These go back to 1973 with the 8th International Congress of Chemotherapy, followed by the 4th and the 8th Mediterranean Congresses of Chemotherapy, and numerous medical events in Greece, including 75 joint sessions in the Pan-Hellenic Conferences of the Society of Internal Medicine, of the Hellenic Society of Infectious Diseases, and of Societies of General Medicine 1997 until today. 52 Meet the Expert events in rural Greece 1997 until today, 25 symposia of the Hellenic Sepsis Study Group 2009 until today, 11 events with the Athens Medical Association and the Intermunicipal Network for Health Promotion of the World Health Organization 2023 and 2024. 6 webinars on new antibiotics 2021 until today, making our society the proton engine force of medical education for infectious diseases in Greece.
The publications of our society can be split into 3 specialized booklets titled Medical Guide for Selecting Antimicrobial Therapy for Hospitalized Patients and Patients in Primary Care, published in 2017, 2018, and 2022, approximately 170 pages each. The Guidelines for Sepsis, published in 2008, 2011, 2012, 2014, 2017, 2023, and updated in 2024, approximately 40 to 60 pages each, 2 in English. 2 international position papers on the adjunctive role of macrolides for the treatment of pneumonia and of the biomarker suPAR to early select patients at risk for death. A special tailored manual for children presented as a short story to help young readers understand infections and the importance of proper antibiotic use, titled Who Trapped Penicillin, means penicillin in Greek. The story is also presented as a theatric play. All our publications are the result of collaboration among leading experts and are designed to meet the needs of both healthcare professionals and broader public.
Our society has an extensive track record of scientific publications in international peer-reviewed journals, of which 124 come from the Hellenic Sepsis Study Group and 5 from the Hellenic Study Group of Endocarditis. The necessity of disseminating advancements in scientific progress and medical knowledge has inspired the development of several new conference and symposium formats for 2025. One format involves outreach to rural areas conducted every 4 months in a designated city. Educational initiatives are implemented at community, including school and parental level, as well as among healthcare professionals. Another one is a large-scale conference scheduled for October 2025, focusing on the principles of precision therapy to guide the use of antibiotics and immunotherapy. That approach was first implemented during our conference in 2024, which attracted over 400 healthcare professionals from across Greece.
Our society fosters innovation on the management of infections caused by extensively and pan-drug resistant bacteria. In this regard, we have published common guidelines with ESCMID and the Italian Society of Antimicrobial Chemotherapy. And we have participated in international position papers with the big international societies for the optimal use of colistin for the critically ill patients. Our international position is strengthened by our lead research in the field, including the registry of novel antimicrobial agents, particularly new beta-lactamase inhibitors like ceftazidime avibactam, and the escalation strategies for the critically ill. Our research is expanding to the community through a recent survey on the positioning of Greek citizens for antibiotics, revealing the approaches we need to endorse to persuade patients not to put pressure on attending physicians for antibiotic prescription.
Building a next generation of scientists with broad knowledge, vision and ideas is the only way to combat AMR. It is necessary that they are able to endorse innovation. Our society has launched this strategy recently. In the last 2 conferences of 2023 and 2024, there are 2 main innovations. Medical students are encouraged to build and present machine learning algorithms for diagnosis and management of infections. And all presenters are young scientists aged less than 40 years. Our vision is to mentor early career scientists on new approaches to combat antimicrobial resistance. This requires an approach not only on knowledge dissemination, but also on development of independent thinking.
Our society achieved all these goals by bringing together all internists, infectious diseases clinicians, and intensivists of Greece into one united research effort over the last 10 years.